everyone, and thanks for tuning in. I'm Sumanth Swaminathan, the co-founder and CEO of Vironix Health. We're a machine learning and healthcare software company, and we've developed the CovidX software platform. It's a personalized remote monitoring and triage software that's meant to assist healthcare institutions, employers, schools, and a variety of other global entities with reopening following the surge of the COVID-19 pandemic. My guest today is Dr. Christopher Landon. Dr. Landon is a board-certified pediatric pulmonologist and clinical advisor for Vironix Health. He received his medical degree from the University of Southern California, and he did his pediatrics residency at Stanford University, followed by an allergy and immunology fellowship at the Children's Hospital of Stanford. Dr. Landon has practiced medicine for over 40 years, and he currently serves as a clinical assistant professor of family medicine at UCLA and an associate professor of pediatrics at USC. He's made remarkable contributions to the Vironix team, and we are particularly keen on hearing from Dr. Landon today as schools reopen this fall. Dr. Landon, welcome.
Thank you, Sumanth. I've been at this, as you know, for 40 years, but really since 1969, where we tried to move a chest X-ray 2 kilobytes per second through a line from Alaska down to Stanford. And so computers have speeded up. So I've maintained an interest in both the devices as well as telehealth. And unfortunately, the COVID epidemic really took all the work I've been doing for 30 years and brought it right to the fore. And so when I want to keep up at the edge, I go to the HIMSS, where we have an intelligent health pavilion. I run a similar booth at the North American CF conference. And this really lets me get all the kids who are right at the cutting edge, who are getting these little $10,000 and $30,000 prizes. So when I have someone who has an actual business and a business sense, it really reassures me that I am moving forward. So as a pediatrician, I'm a member of the American Academy of Pediatrics. I'm a emeritus for the AAP Chapter 2, which is 5 counties down here. Really, the AAP is going, gosh, you know, without the kids there, they're getting developmentally behind. They're losing their social interactions. The teenagers are going to have problems. We need to get kids back in school. But I also deal with teachers, and I was on a call just before this one, and with our Ventura Unified School District. And the teachers are going, hi, I'm over the age of 50. I have asthma. I have diabetes. I don't want to die. And then for our families who are in Oxnard, who have our extended families, where grandma is living there, I go, oh, great. Yeah, put the child in school. And I'm happy that they're maybe less symptomatic, but they may be a carrier for a long time. We're seeing larger and larger numbers of pediatric patients who may be protected somewhat from the coronavirus that's the common cold. So maybe their body understands a little something about it. But we have this multi-inflammatory systemic disease in children. And we have children for whom the pulmonary manifestations, the liver manifestations, kidney manifestations, all these things come to the fore. So I'm very concerned, and there is that balance as a pediatrician I have to maintain of children's health, but also the extended family they go home to. And that's really where I see this Vironix app being helpful. Mm-hmm. To know that the janitor is okay, that the bus driver is okay, that the cafeteria worker is okay, that the teacher's okay, the teacher's family is okay. Before we bring in these potentially infectious children, sure, who may be asymptomatic and spreading, or they may go home and have a little bit of diarrhea, and it is enterovirus season right now, so people have a little headache and diarrhea. Okay, well, where is that as we collect information, and how do we protect not just the other children, but our teachers, our grandmothers, our hospital workers, our bus drivers, our cafeteria workers?
Mm-hmm. Actually, you pointed out 3 or 4 interesting things just now with relation to child susceptibility in schools. And there's an interesting Wall Street Journal article that just came out 5 days back that, in fact, is pointing out something akin to what you just said, right? And the headline essentially said, researchers say new studies and anecdotal reports suggest kids are more vulnerable to the virus than initially suspected. Okay, and so if these kids are carrying the virus, it's not just the children that you're concerned about. You're concerned about all the other staff that they're getting exposed to in schools. And so can you talk a bit, and I think you mentioned how important it is to know who has it, right? But can you talk a bit about, why a tracking software like CovidX, it's using artificial intelligence to diagnose flare-ups among children and users, but also is alerting the institution without compromising the user's health data as to when somebody should be working from home or when the school should be implementing different types of containment measures. Can you talk about how that software can be implemented in some of the schools, let's say in Ventura that you've been around?
We really have to take what you've done and take the CDC recommendations, the World Health Organization recommendations, and integrate them in and start to look at patterns. As you know, I'm a member of Rotary, because that's what happens with white-haired people. We get in a room and it's his service before self. But as we look around the room, we all have grandchildren. We all have young people we interact with. We have a Rotaract, which is 18 to 28, and they want to drink some beer and have some pizza together and, reproduce, I guess. So the impact on that, and that's one of the target areas that really I asked you to pursue, is integrating that Vironix for the grandparents so that we can keep track, so that they can give it to their grandchildren and keep track, give it to their children to keep track, give it to their nieces and nephews and keep track and protect themselves. The AI, there is some clinical judgment. I mean, we like to think of ourselves as doctors as AI, but we are so slammed with trying to keep up with the electronic healthcare record. We very rarely look up and actually, look at the patient in the eyes and see that sweatiness or that paleness, or, remember to ask, oh, gee, you look a little uncomfortable. Did you have diarrhea this morning? So we really need to be able to pre-screen, continue that screening. The other thing is for large staffing. If we have people working from home or people who need to come into work, it's not just a matter of one person or two person shop where you can keep them 6 feet apart. But when you have 50 workers, 100 workers, 1,000 workers, you need to plan. There's Gantt charts. You need to prepare. Gee, if I'm missing at this level, these people, that Toyota is not going to be built if I can't get the lug nuts on the front wheel.
Sure.
Really being able to plan from a staffing standpoint as well.
Right. And you can imagine that maybe 1,000-person type company, if they're implementing pure temperature checks right at the front of the building, even, lines or crowding at the front of the building itself, could be a source of infection. Right.
That's really not the best measure, frankly.
Right. And then the global data sets seem to be suggesting that. Well, look, Dr. Landon, thank you for your time, for your experience. You have an extraordinary history, in patient care and technology development and all of your collaborations. We appreciate your time and your insights today. And we look forward to speaking with you again soon.
Thank you so much for this opportunity. I enjoy working with Vironix and where you're going.